My name is Allison Jackson. This is the head to toe assessment, August 30th, 2025 for FNP1 with Dr. Perry. I am going to scan the room. Ceiling, floor, supply table. All right, I'm gonna first inspect the skin for color, skin of the head and face, anterior and posterior chest, abdomen, upper extremities and lower extremities. I'm assessing for color, warmth, temperature, turgor, texture, bruising, scars, lesions, and edema, bruising, scars, lesions, and nevi. I will start with the head and face. I am looking for symmetry in midline position. I'm going to inspect the scalp for hair texture and distribution, depressions, masses, lesions, and infestations. I'm going to palpate the temporal arteries for tenderness. I am also going to palpate the lymph nodes, pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I will also be assessing for TMJ. Open your mouth for me. I'm assessing for any tenderness, crepitus, or subluxation. I will now move to cranial nerve 5, which is the trigeminal nerve, by assessing light touch sensation. So close your eyes and just tell me where I'm touching you.
Forehead, left cheek, right cheek, chin, nose.
Cranial nerve 5 is intact. Now I will assess cranial nerve 7, which is the facial nerve. Smile, frown, puff your cheeks, pucker your lips, and raise your eyebrows. All right, cranial nerve 7 is intact. Now moving on to the ears. I'm going to be assessing the ears for symmetry, and I'm going to palpate the pinna and the tragus for tenderness or masses. I am going to assess the auditory canal and tympanic membrane. Tympanic membrane is intact and pearly gray. Tympanic membrane intact and pearly gray. I will now assess cranial nerve 8, which is the vestibular cochlear nerve, by a series of tests, starting with the Weber test for lateralization. Tell me if you hear this in one or both ears.
Both ears.
Okay. Now I will do the Renee test. Tell me when you no longer hear the sound.
No longer hear the sound. I no longer hear the sound.
Okay. And on the other ear.
I no longer hear the sound. No longer hear the sound.
All right. Air conduction is greater than moan conduction. Now I will do the whisper test. Cover your left ear.
1, 2, 3.
And cover your right ear.
1, 2, 3.
All right. Cranial nerve 8. Vestibular cochlear nerve is intact. All right, now I'm going to move forward to the eyes. I'm going to be inspecting the lashes and the brows, the conjunctiva for color, and any drainage or lesions, palpebral fissures, and the sclera. I will assess cranial nerve 2, which is the optic nerve for gross visual acuity. Cover your right eye and read the smallest line.
LTFPH,
Cover your left eye.
LTFPH,
Okay. And peripheral vision, just tell me when you see my fingers.
I see your fingers.
Alright. And now cranial nerve 3, which is the oculomotor nerve. I will be assessing the pupil's response to light. And I will also be assessing cranial nerve 3, oculomotor 4, trochlear, and 6, abducens by assessing extraocular movements. So follow my finger. And then follow my finger into your nose. Okay. Now I'm going to assess the internal eye structures. Look here. Okay. Okay, now I'm going to move forward to the nose. I'm assessing for its position and symmetry. I'm going to assess nasal patency and cranial nerve 1, which is the olfactory nerve, at the same time. Close your eyes and include your right nostril. What do you smell?
A fruity candle.
And keep your eyes closed and cover your left nose, neck there. And smell? What do you smell?
Same fruity candle.
Okay, great. I'm also going to palpate the frontal and maxillary sinuses. Frontal and maxillary sinuses for tenderness. And now I will assess the throat and mouth, and I'll ask you to open your mouth for me. I'm going to be looking at the teeth, the buccal mucosa, the tongue, the floor of the mouth, the posterior pharynx, the soft palate, salivary ducts, and tonsils. If they are present, I will grade them, so I'll ask you to open your mouth and say ah. Okay. That is also assessing cranial nerve 9, glossopharyngeal, and 10, the vagus nerve, the soft palate, and uvula rise with phonation. And now I will assess cranial nerve 12, which is the hypoglossal, by sticking your tongue out. Tongue is midline without fasciculations. Okay, now I will assess the neck. I'm assessing for tracheal in the midline position. I'm going to palpate the carotid arteries. I'm also going to auscultate with my bell for bruits in the carotid arteries. Okay, I am now going to palpate the thyroid gland, so raise your chin and swallow, all right. Alright, that concludes the neck, and so now I will assess the posterior chest. If you'll turn around for me, please. And here I am assessing for respiratory distress, tripoding, nasal flaring, use of accessory muscles, tachypnea, and cyanosis. I am going to assess for symmetric chest rise. Take a deep breath. Okay. I'm going to percuss over the lung fields for dullness or tympany. And now I will auscultate, starting above the scapula. including the left lateral and right lateral for the right middle lobe. Okay. And now I will auscultate for bronchophony. Say 99 when you feel my stethoscope.
99, 99, 99, 99, 99, 99, 99, 99.
Now egophony, say the letter E.
E, 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 E.
And now whisper pectoriloquy, whisper 1, 2, 3.
1, 2, 3.
Whisper.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Now I will assess for tactile firmness, say 99.
99, 99, 99, 99.
All right, great. Now I will have you turn around and I will assess your anterior chest. I'm going to assess for symmetrical chest expansion. All right, and tactile firmness.
99, 99, 99.
Okay. I will now auscultate the anterior chest. Okay, and that concludes the anterior chest. I will now move on to cardiac. I am going to auscultate all 5 cardiac points, starting with the diaphragm. Aortic is second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, third intercostal space, Erb's point, excuse me. Pulmonic is second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid is fourth intercostal space, left sternal border. And mitral, fifth intercostal space, mid-clavicular line. And now with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. I will now locate the PMI in the fifth intercostal space, mid-clavicular line. And I will auscultate for 1 full minute, noting the rate and rhythm. And I will ask you to lie down at a 45-degree angle. All right, and here I'm assessing for any heaves or lifts. I'm assessing JVD. I'm also going to palpate each cardiac point for thrills, starting with aortic, pulmonic, Erb's point, tricuspid, and mitral. I will auscultate as well using the bell and the diaphragm, all 5 cardiac points. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And that concludes the cardiac section. Moving on to abdomen, I'm going to be assessing the abdomen for shape and contour. I will start with percussion in all 4 quadrants for any dullness or tympany. I will now palpate all 4 quadrants for any masses or tenderness. I'm going to palpate the liver as well as the spleen. And I'm now going to auscultate for bowel sounds in all 4 quadrants. Okay, and I'll have you sit up and face the back wall. this hurts.
No pain. No pain.
Alright, go ahead and turn back around. And now I will be moving on to the upper extremities. I'm going to check capillary refill in both extremities as well as palpate a radial pulse. I am inspecting and palpating the joints of the fingers, the wrists, the elbows, and the shoulders. I'm looking for any redness, swelling, tenderness, symmetry, nodules, deformities. Redness, swelling, tenderness, nodules, symmetry, deformities, and crevice of the joints. Now we will assess range of motion of the fingers with flexion, extension, and hyperextension. Now range of motion of the wrist, we have flexion, extension, hyperextension. We have ulnar deviation, radial deviation, and rotation. Now range of motion of the elbows, we have flexion, extension, hyperextension, and range of motion of the shoulders, we have flexion, extension, hyperextension, internal rotation, external rotation, and circumduction. And now I'll assess strength of your hands. Squeeze my hands, 5 out of 5. Strength of the biceps, pull, 5 out of 5. Now push away, 5 out of 5. Now strength of the shoulders, push out, and pull in, 5 out of 5. Now strength of the shoulders, also spinal accessory nerve, which is cranial nerve 11, show your shoulders. All right. Okay. Now, light touch sensation of the upper extremity. So close your eyes and let me know where I'm touching you.
On my left forearm, on my right forearm.
Okay. Now for stereognosis and graphesthesia, I'll ask you to close your eyes and identify this object with your left hand.
Key.
Okay. And hold out your right hand, keep your eyes closed, and let me know what I'm drawing.
A circle.
Okay. And now for cerebellar function, with rapid alternating movements with hand flips, serial finger opposition, and touch my finger. No, your nose, then my finger. Awesome. I will now assess vibratory sensation over the ulnar prominence, so hold your hands out for me. All right. And also over the medial malleolus, if you'll bring your feet out for me. All right. I will also be assessing the deep tendon reflexes, starting with the brachioradialis, the biceps. Relax your arm. Okay, relax your arm. And the triceps. Let your arm rest on mine. Relax your arm. The patellar, relax your legs. And the Achilles, Make sure your feet are in there. And Babinski. Okay, now moving to the lower extremities. I'm going to inspect and palpate the joints of the toes and the ankles, the knees, and the hips. I'm again looking for tenderness, redness, swelling, deformities, nodules, tenderness, swelling, redness, deformities, nodules, symmetry, and crepitus. And we will assess range of motion in the toes. So if you'll do both feet, you can sit down, do both feet with me. Flexion, extension, hyperextension, abduction, and adduction. Do the left foot too. Flexion, extension, hyperextension, abduction, and adduction. I'm also going to palpate the dorsalis pedis pulses and the posterior tibial pulses, as well as check capillary refill in both feet. Now, range of, I'm going to do strength of the foot. I'm going to ask with dorsi flexion and plantar flexion, so point your toes down against resistance, and now up. And range of motion of the ankles, you do both. I'm only going to do one, but you do both. Flexion, extension, inversion, eversion, and rotation. And now I'll assess the strength of the knees. Relax. Push against me and pull. Strength 5 out of 5. Strength of the hips, push out, pull in. Strength of the hips, 5 out of 5. Now I will have you stand up. And range of motion of the knees, we have flexion, extension, hyperextension, internal, no, that's the hip, I'm sorry. That's it for the knee. And then left knee, flexion, extension, hyperextension. Now range of motion of the hips, we have flexion, extension, hyperextension, internal rotation, external rotation, circumduction, and left leg, flexion, extension, hyperextension, internal rotation, external rotation, and circumduction. That was range of motion of the hips. Now range of motion of the cervical spine, you're going to flexion, extension, hyperextension, lateral flexion, and rotation. And I'll have you turn to the side, and I'm assessing, I'm going to have you bend over. This is flexion of the spine. I'm assessing the spine for any obvious deformities, scoliosis, curvature, masses, tenderness. So this is flexion, stand up, extension, hyperextension, lateral rotation, and, or that was lateral flexion, sorry, and now rotation. That was the spine. And, okay, now is the Romberg test. So if you'll stand this way with your feet together, close your eyes and hold your arms out. This is the Romberg test. Now I'll have you walk normally. Go walk normally and turn around. Now that was regular gait. Now tandem gait is heel to toe. If you'll walk heel to toe. Regular gait and tandem gait. And now I'll have you back up just a little bit and hop on one foot. hop on your other foot. All right, this concludes the head to toe assessment.